Good afternoon, and thank you for joining us for the final session of the 2024 Older Adults and Opioids webinar series hosted by the Finger Lakes Geriatric Education Center, a HRSA-funded geriatric workforce enhancement program at the University of Rochester, and our co-sponsor, the Western New York Rural Area Health Education Center, also a HRSA-funded education center. This year is the 5th year we have been hosting these educational sessions, so thank you so much for your support and for tuning in. My name is Laura Robinson, and I am the program coordinator for the FLGEC, and my co-host is Christine Chappell, the administrative coordinator at the Western New York Rural AHEC. And I just have 2 housekeeping items for you. We are using a Zoom meeting format today. There are 2 important buttons on your toolbar. Please use the chat button to type hello, introduce yourself with a name, job title, agency, or location. We love to know where everyone is from. We do have at least 4 different states and 2 countries joining us today. And the chat button will allow you to type in a question for the presenter. And you can use this button at any time during the presentation to ask a question. We will leave time for questions at the end of the session. The other important button is your microphone button. Please keep muted throughout the presentation. Thank you. So now I will go through our slides. So we are so glad that you are here. Charlotte Crawford is presenting opioid overdose prevention, a Narcan training for us today. We are offering CME, social work, PT, OT, and licensed mental health practitioner credits. None of our speakers or the planning committee have any financial disclosures or conflicts of interest. Following the webinar, we will email you instructions on how to claim credits. So please allow up to 30 days to receive your credits. It does not usually take that long, but if you email me Monday, I'm going to let you know that they're not ready yet. So give us at least a week, but up to 30 days. And no commercial funding was received to support this activity. So I'm going to stop sharing those slides and share Charlotte's slides while I introduce her. So hold on while I pick the right screen. Okay, that should, Charlotte, does that look okay?
Looks good to me.
All right, thank you. So Charlotte has been our speaker for this presentation for the last 5 years because she's amazing and awesome. But she joined the Lake Plains Community Care Network, or LPCCN, back in 2000 and then became CEO in July of 2015 until December of 2021 when she retired. Her responsibilities over the years included grant submissions and oversight, creating partnerships and chronic disease initiatives for Orleans, Genesee, and Wyoming counties in New York State. In 2007, she led the initiative for LPCCN to become the Big Lakes Emergency Medical Services Program Agency. This program initiative focuses on assisting emergency medical services in Niagara, Orleans, and Genesee counties, and also to meet New York State requirements and provide education and other services identified by Big Lakes and the EMS agencies in that region. Charlotte has always been involved in healthcare, serving as a nurse in various capacities and as a paramedic for 43 years. She's been an educator in both volunteer and professional environments. Now in her retirement, she volunteers at her local fire department and in her church's clothing closet. In addition, she will continue to teach Narcan classes, CPR and first aid, and other topics as requested. She hopes this will keep her from becoming bored. So we are thrilled to have Charlotte with us again this year. So Charlotte, please take it away.
Okay. Good morning, everybody. I'm really pleased to be on here. Like she said, it's my 5th year doing it. I love it. I think it's exceedingly important for people to know about Narcan, how to get it and how to administer it and when to. So next, please. And I have to apologize, for some reason, I can't bring the slides up and share my own. So people are being wonderful for me and doing it for me. Like she told you in the introduction, and we don't get any financial support from any of this. So go ahead next, please. The biggest thing we're going to learn is signs and symptoms of an opioid overdose. I think a lot of this has been around a lot and everywhere. The Good Samaritan Law as it pertains to opioid and Narcan, how to use it to reverse an overdose, and the reporting and follow-up is not as important as it used to be. because I don't collect it anymore, so it's not important to me, but I don't understand how the state does it anymore. And you guys can check with your local agencies to see if they collect any data whatsoever. I know there's a site on the state, New York State at least, where you can enter your own data. Next, please. The best thing about this program is it allows anybody in the community to administer Narcan with training. This is a more intense training that you get some other places. Some people say, shove it up the nose, go away, and that's it. I like to make sure people understand why, and I like to make sure that people understand some background to it. This is funded by the Department of Health AIDS Institute in as that they give me the Narcan to distribute. Next, please. This whole thing took effect in 2006, making it legal for anybody in New York State, non-medical person, to provide Narcan. This is huge. The biggest problem with this in 2006 is it was only available in injectable form. So that automatically eliminated 95% of your EMS providers, and there was hesitancy in regular public to do it with an injection because needles are scary, and if you aren't comfortable using them, you probably won't use them for somebody else. Next, please. Most opioid overdoses are witnessed in as that somebody's there with them while they're using, or they're in a family home or a friend's home. So that gives a chance for people to give them the Narcan and reverse it before there's any undue outcomes. Some people are totally afraid of calling 911, and there's a lot of reasons for that. I mean, it could be anything as simple as a kid's someplace where he's not supposed to be and he's afraid he's going to get in trouble with his parents, to someone being on parole or probation and knowing they're going to get in trouble if they do. The ineffective things I've seen, I pulled up on a call one time and there was a couple that were literally dragging somebody back and forth in the front lawn, thinking they could walk it off. That doesn't work so well with Narcan when you're not breathing. So this is not a real effective way to use it or do it. But the biggest problem is when people just leave. Because if you just leave on somebody who's got an opioid overdose, at some point in time, the breathing will stop and they will die. Next, please. Okay, I'm going to tell you the abuse of opioid drugs is continuing and it's getting worse. I pulled some data. Actually, I'll do it for opioid deaths right now. That's from 2020 to 2021. I'm not going to give you exact numbers, but I will tell you that statistically it increased in every age, whether you're male or female, what your ethnicity is, or the region that you live in. It's increased in between those 2 years, with the exception of the 18 to 24-year-olds. That actually decreased by almost 5% in that age range between 2020 and 2021. And those are deaths. Those are overdose deaths. Now, I find that very depressing because we're trying to get Narcan out. Narcan is much more readily available, and I fully believe that it has to do with the combining of other medications, drugs, with what people are using. But back to this, the most important and immediate problem we have is respiratory depression. If you have somebody with respiratory depression, it can lead to they'll stop breathing. How about that? Stop breathing. And if they stop breathing within 4 to 6 minutes after someone stops breathing, there can be brain damage. And if you don't do something quickly, it'll lead to death. You can give Narcan. Narcan works very well. It's very effective. And it's a great tool to have in everybody's toolbox. And I do mean everybody's toolbox. Next, please. When it talks about different socioeconomic and groups and regions, I'm going to tell you, I've been an EMS, like she said, for 43 years. When I first started and we were going out for somebody who had a heroin overdose, there was no mixing of drugs. It was just straight heroin. And we were using needles at that time. It was, and I'm sure you've heard the term, and I really, really hate it, junkie. They really were the people, it's bad. I don't like to be putting people in little silos, but they tend to look the role. They were usually somebody who was rough, not clean, they were shaggy. They were just not well cared for. You don't see that anymore. Now you see people from everywhere can be impacted by this. People who use it for pain control. I had a woman one time, we went on a call, got to the woman's house, family called, loving family. She's a woman who was end-stage cancer, had fentanyl patches, and her family had called and said, mom's not breathing very well. They called the ambulance and we went out there and checked her out. And so I asked what medication she was on. And one of the things they told me was fentanyl patches. So I said, okay. I said, when was the last time she had a fentanyl patch applied? 2 daughters spoke up at the same time and said, today. So I look at them and they both looked at each other. I went looking for the fentanyl patches. I didn't find 2, I actually found 3, took them off, gave her some Narcan. She came back around. But the problem with that is when you do that with someone who's getting fentanyl for pain relief, they start getting pain. They have pain because you've taken away the only medication that was working on them for the pain. Young people, we all know kids like to play around. They like to do things their peers are doing. They find stuff in their parents' grandparents' medicine cupboard. They try it out. Or you can have someone who is prescribed a medication from their provider because they had a broken bone or some other injury that's painful, and they were given a short-term supply of it to use and decided, like, I like this stuff. And then they start looking for other places to get more. The ones that are really hard for some people, they're longtime users that have been in rehab, have come out. I picked up a gentleman one time who had overdosed, and I get to the scene. The person he was with when he overdosed had left him alone, but he had given him Narcan. So this was good. We get there. He's still unresponsive, gave him another dose of Narcan, and he came around. He looked up at me and he says, oh man, I screwed up. And I said, we all make mistakes. Let's get you some help. And he goes, I just got out of rehab. Please take me back. So we did. The thing is, he was doing really good until he ran into a friend who said, hey, one more time, old time's sake. And he fell for it. Okay, next, please. This is some data. We did a lot of things, Genesee, Wyoming, Orleans, because that was the opioid task force that I was part of at the time. In 2015 to 2020, these are the death rates per 100,000 in our region. If you look at 2017, you're going to see that we had 36.2 per 100,000. That year, our per 100,000 rate beat Erie and Monroe County, and those counties are significantly larger than Genesee County is. But this gives you an idea that there is a concern and there is a problem when you start comparing things apples to apples rather than apples to oranges, because the next slide, please, actually shows you how many deaths we did have, not per 100,000, but the actual deaths we had. So you can see 21 in Genesee County in 2017. The nice thing I liked seeing is because 2017, you're going to see we started doing more training and getting more Narcan out. We started seeing a decrease. Next, please. Okay, this is another way that we presented. This is 2020 to 2022. This is more recent data that we could get. And you'll see the difference between male and female, which is pretty much close to what you see in the state, because it's usually a 3-to-1 for the difference between males and females. This one's more of a 2-to-1, but the ages are very reflective of what you're going to see in the state data. In the state data, I think I told you that they had an increase in 2020, which 2021 over 2020, which was kind of sad. But I'll tell you, I think part of the reason for that, and this is my own, and after talking to some providers, and I don't know if you guys will agree with me or not, those who are in healthcare, in 2020, the world shut down. People couldn't get in-person help. So they were doing things either telephonically or Zoom meetings or some other way, or in very limited numbers. So that if you lose the personal touch on people that are going for help and they're not getting it, they slide back. And that's what we saw in our area. I don't know so much if other people saw it in their own, but it was very difficult. And that's, I think, my feeling is why we saw more deaths in 2021 versus 2020. Next, please. These are known Narcan administrations. Now, here's a little caveat for this. The only reason I have this data was I was actually physically collecting it in my office. I would get the report forms from agencies all over the place. This is primarily law enforcement and EMS. And the little dangling carrot was, if you give a dose, I'll give you a new kit. So they were pretty good about turning in, but not perfect by a long shot. But these are the ones we actually collected. And you'll see in 2017, we had some Narcan, and in 2018, we had more administered. So I really think the reporting actually fell on its face, especially in 2020. After that, forget it. We weren't getting anything from anybody. Next, please. Now, this data is all overdoses, not just the opioid overdoses. And this came from the hospital visits in the in the region. It's just so you get an idea of overdoses overall. Next, please. Okay. From 2021 to 2022, October to September, I received information of overdoses that were transported to Genesee County's hospital. This is how the ages broke down demographically. As you can see, and it's very interesting, 12 plus in the 65 plus age. That's interesting because people don't necessarily think of 65-year-olds taking recreational drugs. So for me, that doesn't tell me, it tells me that they need more guidance on how to take their medications appropriately and or need to be worked up for possible suicide ideology. I don't know. It's just numbers boggle me, and I'd like to know more about it. I'd like to delve deeper and find out why, but there's no way to get that data. I've always wondered, most people say, when I first started doing Narcan training and stuff, it was very difficult to get people to let me do it because they said, well, listen, these guys want to die, obviously, or they wouldn't be doing it, which I won't even go and explain how wrong that is. And in my belief process, it's so wrong. But I belong to a suicide prevention coalition. And one of the things we always wondered was how many of these could have been potential suicide attempts. Nothing better than take something, too much of something, and fall asleep and never wake up. We don't know. We weren't getting suicide notes. So we'll always wonder about the details on these things. These are just numbers, but they don't tell you everything. Next, please. There's a program called OD mapping that law enforcement tends to use, and this is reported in 2022 for Genesee County through the OD mapping. You can look and see if you have it in your regions as well. It's a free program for EMS, but not EMS, I'm sorry, law enforcement, where they can actually help keep track of things. Now, the reasons these numbers are a little bit further are different from what you'll see with other ones is because this is just law enforcement. It does not include EMS or civilian. Next, please. This is our recorded Narcan training we did up to 2021. You'll see in prior to 2017, there wasn't a whole lot being done. And a lot of times we had to beg to do it, which was nice. But after 2017 and getting the news out of how many people had died and how bad our statistics were in Genesee County and other counties, people started calling and saying, hey, can I get some training? So you can see the numbers increased in 2018. 2019, they weren't bad. They dropped off in 2020. Again, world shut down. The only way I could do Narcan training was online, and it was very difficult to do that way. In 2021, those were all online. Next, please. Now, part of the reason we have problems is in New York State, we got the I-Stop law that started in 2013. That totally changed the way medications were prescribed. You used to go to your doctor's office, they'd take out their script pad and write you a script. That was it. Now, all this data had to be done real time. It had to be done electronically, and it required doctors and prescribers to look to see if you already had a script for the same medication or similar medication before they could actually write the script for it. Next, please. You can see where it actually started taking effect. When this came in effect, people were doc shopping. I worked in the emergency room for many years, and prior to this starting, we used to have people coming in mostly at night because you know what you can't do at night? You can't call the pharmacy to double check. So they would come in at night and say, I need, or I want, my kids flushed my Narcan, my pain meds, or I dropped them, I lost them. They make up excuses, doesn't make a difference. but they would come and we had no way of checking to see if they were going for other places. Red flags. If they were coming from another county, red flags. But we had no way of actually checking it. But once the I-stop came in effect, we could. Next, please. Now, it's really important to know what opioids are, and I'm lying. We don't care. Those are just some of the medications that are and what's not. The thing I'm going to tell you right now is I don't care what a person takes. If they have signs and symptoms of respiratory depression and with unconsciousness, I'm going to suspect an opioid overdose until proven otherwise and administer Narcan anyways. It does not make a difference. Nothing drives me crazy more than going to a scene and having somebody talking to somebody that's there. What did you take? What did they take? What did they take? Don't care. You're treating the symptoms, not the drug. So don't care. You're going to treat the symptoms. You're going to give them the Narcan if it's appropriate and go from there. Next, please. Now, when it's straight heroin or another opioid over counter or whatever, pill form that doesn't have fentanyl in it, it can take 1 to 3 hours. If you have a needle in the arm death, I can almost guarantee you 100% that it's got fentanyl mixed in, at least fentanyl mixed in. There could be other things too. Now, what it does is it decreases your urge to breathe. So obviously you're in decreased respirations and not breathing well, breathing stops, and then your heart stops. Next, please. Next couple slides, it's basic thing, same thing, but just presented differently. So, like I said, it doesn't happen immediately, straight heroin or pills. You get somebody who's kind of nodding off on you. I used to tell students in my class, because I taught at GCC for a few years, if you fall asleep, I'm going to think you have an overdose. But anyways, they would still be arousable. They may start snoring because now you're starting to get an airway issue. And if they're drooling, they probably are droolers to begin with. Now, they've overdosed now. They're not responsive. They could be very shallow breathing, or it may be gurgling because the airway has secretions in it. The skin changes. I don't like the blue lips and nails. It's more of a dusky gray. But then once it gets start going down that far, you're going to have a fatal overdose and you'll die unless you do something to change that. Next one, please. So we know the opioids repress the urge to breathe. So the breathing slows down. The breathing stops. Carbon dioxide levels increase. So oxygen levels decrease. There's a lack of oxygen, can cause brain damage. But if it continues, the heart will stop and you'll die, or they will die, not you. Hopefully not you guys. Okay. But there's time. It takes time. So there's time for you to do something about it. And you don't want to waste time, but you want to do something as quickly as you can. Next, please. Narcan is the drug of choice because it is about the only thing that reverses an opioid overdose. Matter of fact, it is the only thing. It can be administered 3 different ways. It can be given IV, injectable.
I think it's fair if Michael and Judy both heard it.
They both did.
That
I'm sorry, is there questions?
No, sorry about that. Somebody unmuted their mic.
Oh, okay. Okay, so anyways, 3 different ways to give it. The most common way now is intranasal, and it works by blocking where the opioid attaches to the receptors that take medication. But it only works for 30 to 90 minutes. That is something that's really key to remember. Now it steals the parking lot. And the next slide, please. The next slide actually gives you a little visualization for it. You can see the opioid, the yellow or orange colored opioid trying to get onto the receptor sites. Narcan blocks it, but again, only for 30 to 90 minutes. That's really important to remember. Next, please. So the Good Samaritan Law for this is different from CPR in that it has some legal components to it. You really want people to call for help if there's an overdose. This offers protection for the things below, but it does not offer protection for sales. So you have to be very careful, and people know this. People know what they're going to get in trouble for, most people. Next, please. The things that does have limitations, you have to remember this. These are the things that it does not offer protection for. I'm not going to read it, so go ahead and read it. And the bottom bullet is the reason why a lot of people don't want to call for help. And that's because it doesn't extend to outstanding warrants, probation, or parole violations or other drug-related crimes. So if somebody is there, they could potentially get in trouble. If they're if they're not supposed to be around people that are using drugs and they're around somebody who's using drugs, they could very well get in trouble for that, whether they used or not. So that's something that they're very concerned about. I know, and I tell people who are in this situation, because I do training for these people, and I tell them, if you're ever someplace where someone has overdosed, please, please, please don't just walk away, because you're going to have to live with the fact that they've died. Give them the Narcan. Call 911, call 911 first, give them the Narcan, lay them on their side, wait a couple minutes, give them a second dose if they haven't come around yet. And if you have to leave, go for it. And if you don't, please stay. Next, please. This is, if you can't sleep some night, look up the penal laws that are there. This is the extended version of the last two slides. So if you ever get curious and can't sleep, feel free to read it. Next, please. And this is the second portion that was on the previous slides. So you can write down that penal law. Can't sleep, guaranteed you will. Next one, please. Now there's also an overdose law that's a public health law. This protects non-medical people who administer Narcan from any kind of liability. You're not going to hurt anybody, okay? It's considered first aid or emergency treatment. It's not an unlawful practice of profession, because some people feel if you're giving somebody a medication, you're practicing medicine. You are not. And allows the medical provider, so nurses, doctors, whoever, they can provide it, and it's first aid. It's no different than doing CPR. So that's huge, because I actually got into a discussion with a nurse one time who says, well, they wouldn't do it without a doctor's order. And I said, do you call them for orders to do CPR if you find somebody? Well, no, then you don't have to for this either. It's the same thing. You're doing first aid. Next, please. I always put this in here because this is a picture of what it was originally when it came out. Originally, it was two little vials and a syringe with a needle on it. But like I said, a lot of people were not comfortable administering shots, and I don't blame them. It's if you've not been trained, you're not quite sure what to do with it. When it first came out, I had EMS providers going for training, because we had people in the area giving Narcan training with the syringes. And they called me and said, hey, can you teach me how to give a shot? And I'm like, no, it's not in your scope of practice. Why? And he says, well, I've got Narcan. And I'm like, oh. So I had to call the company, and the agency was doing the training. I said, listen, if you get anybody who comes to you for training, I have no problem with that, but please send them to me for the Narcan, because they can't give injections. It was shortly after that, probably within the year, that they stopped doing the training with the injectables, which was good, because anybody below a paramedic level could not administer Narcan with an injection. Next, please. This was the second iteration of the Narcan administration. They have the nasal atomizer, which is the white tip on it, but it was still a three-step putting it together. You had to take the medication, put it into the little syringe thing, and then put the nasal atomizer on it. Now, that's all well and good, but you give people too many steps, sometimes something gets missed, and it did. And if you're just injecting, it's not an injection, it's a nasal. If you're just putting in the nose without the atomizer, it's just like pouring liquid down someone's nose, because it's not being broken down to the point where the nasal mucosa can absorb it. So that was useless without the nasal atomizer. And I can't tell you how many calls I went on. They had the atomizer, they never put it on. So they gave them that Narcan, and they were really surprised when mine worked and theirs didn't. So that was a pain. It was confusing for people. It was cumbersome, and it was not convenient for people. Next, please. This is what we now have. The boxes have changed a little bit, but it's still the 4 milligram. Now, the old stuff was 2 milligram. And the thing you have to keep in mind is the nasal mucosa can only absorb so much liquid at one time. And there were times where people were dumping 3, 4, 5 of the 2 milligram doses in. And after a point, I had an ER doc tell me after 4 doses, it's not doing any good. They're not getting anything from it. It's going down the back of their throat. This doubled the dosage, which is nice, because you can give 2 doses and get 8 milligrams versus the 4 doses they were doing, which were ineffective. This is good. This is also exceedingly easy to give. The hardest part about this one is you have to remember not to test it, because as soon as you push the bottom little button there, it dispenses the medication and the medication is gone. Next, please. The best thing about the nose, everybody's got one pretty much. I do tell people if someone has fallen or has nasal injury, please clean it up before you try to put it in. Just use whatever you've got to wipe the nose off a little bit, get the blood out if there's blood. It doesn't hurt to do it. They don't feel anything when you're doing it, and you don't have to worry about a needle stick. Next, please. This just shows, I kept this slide, even though we don't use this one anymore, because it shows you how it breaks up and sprays into the nasal mucosa. That's where it's best absorbed. It's rapid absorption. It can work very, very quickly, usually within a couple minutes, absorbed that way. And it's a great effective way to give medication. There's other medications we give this way as well. Next, please. This is how you hold the new ones. But again, remember, don't push that one where the thumb is, because if you do, the medication is gone. You're going to put it in the nose, and then that's when you're going to depress it. And if you're giving more than one dose, switch nostrils. Next, please. Next, please. Again, that's the one we're going to use. So go ahead. I'm sorry. Go to the next one. Okay, signs of the overdose. Person is usually unresponsive. If they're talking to you, they're not in need of Narcan at that point. So they're going to be unresponsive, passed out. You can't wake them up. The breathing may be slow. They may have just a couple breaths a minute. They may be making gurgling sounds, especially if they're laying on their back, because they may have secretions in their airway. The lips, again, may be dusky colored. You want to check to see if they respond. So shake them, and don't be shy about it. Don't be gentle. Shake them good. And if you don't get any response, it tells you to grind their knuckles in their chest bone for 5 to 10 seconds. That's painful. If that does not wake them up, they are truly, truly unresponsive. And if you don't wake them up with that, call 911 right away and let them know that you think someone has overdosed. Next, please. So here's my little soapbox. If the person's not breathing, do rescue breathing or CPR if you need to, because they don't have a pulse. My soapbox is everyone should know how to do CPR. If you don't know how to do CPR and you don't know how to do rescue breathing, if the Narcan doesn't work, they're going to die. If they need rescue breathing and you can't do it, they're dead if the Narcan doesn't work. Next, please. So to give the rescue breaths very quick, I'm not going to ask, usually in my class, say, how many know CPR? I get a head count. But anyways, you're going to give 2 breaths, and then you give 1 breath every 5 seconds. What you do is you wait, you pinch the nose, breathe into the mouth, or if you have a pocket mask or whatever else is laying around to give you a barrier between the person and who you're breathing into. You're going to give 1 breath, and just until you see the chest start rising, because if you blow to see how big you can get those lungs going, you're blowing air into their belly. I will guarantee you, if there's anything in that belly, you keep that up, you're going to see it. So please don't do that. Just till you see the chest start rising, then back off. Then give 1 breath every 5 seconds. Keep breathing until help arrives if they don't start breathing on their own. Next, please. Now, you give Narcan, and we're fortunate enough and they wake up. Tell them what's happened. Don't leave them alone, and tell them not to take any more drugs, okay? Because if they take any more after the Narcan, again, only for 30 to 90 minutes. If they take any more, they can actually put themselves back down into a respiratory depression, to respiratory arrest, and actually die. Now, stay with them until the ambulance comes. Let the ambulance crew know what you've given them and how much you've given them. You can repeat the Narcan in 2 to 3 minutes. Now, if they start coming around, lay them on their side, because sometimes people are nauseous and you don't want them throwing up, because it's hard to clear an airway once they've clotted it up. My big point here, which is why the big black bold there, is strongly encourage the person to go to the hospital. Twofold. If they decide to stay home and they don't have Narcan, or nobody there has Narcan to give them, if they go under again, they could die. Plus, if you take them to the hospital, that may be where, and I don't know what your systems are like, but here in Genesee County, we have peer advocates who will work with these people. If they're ready to go into recovery, work with them, get them where they need to go, and help them any way they can. That's where they meet them, is at the hospital. That's the first introduction they get to them. Next, please. This is how you'd lay them on their side. It keeps them from choking. You have to prop them up a little bit. So use their top leg to hold them over a little bit. That helps keep them in position where you don't have to worry about them rolling over onto their face. Next, please. Now, there are some common side effects of Narcan, but I'm going to tell you, if you're the one who administers the Narcan and they're going to be picked up by an ambulance, chances are you won't see them. You might see some nausea, you might see some vomiting, but you're not going to see the rest. But bottom line is, if you don't give them the Narcan, not breathing is what's going to kill them. So you need to get them breathing again, one way or the other, while you're giving them the Narcan and it works for them, or if they're not breathing and you do CPR or rescue breathing at least. Next, please. Now, you can give Narcan. I told you, I don't care what they took. If you suspect an opioid overdose, give them Narcan. Situational, you're someplace around and you see paraphernalia and somebody's overdosed, give them the Narcan. If they're hypoventilating, which means they're not breathing well, or respiratory depression, they have low effort where they're breathing, give them the Narcan. I'm going to tell you, this can happen absolutely anywhere. I had a couple good friends had gone out to a restaurant and they got to the location. All of a sudden, somebody comes out of the women's room and they're yelling, someone's unresponsive. So the guys went in, didn't care. Guys went in, their wives carried Narcan for them in their purse, grabbed their wives' purses, went into the bathroom. The woman was an overdose. They gave her the Narcan and she woke up. So you never know when you're going to run into it. I will tell you right now, I was looking at some data. It's about a 50-50 between being a public place and a home for overdoses. So nothing is exclusive for that. You could have somebody go in for a meeting with somebody and go unresponsive because they took something before they went in. You just don't know, and it's better to be safe than sorry and have what you need. Next, please. We don't care if it's a street drug or a prescription drug. Both cause respiratory depression, and Narcan works with it. So don't hesitate to use it because it's not going to hurt them if it's not an opioid overdose. Next, please. Okay. This is a do no harm. They get a wet nose. That's the worst thing that's going to happen. It's only going to work on opioids. It's not going to work on other medications that can cause respiratory depression too, or it's not going to work on medical conditions that can cause respiratory depression. It's only going to work on opioids. Next, please. Now, key, has to be stored between 59 and 77 degrees. So that means you can't keep it in your car. We're coming into some pretty hot weather coming up. It would totally make the Narcan ineffective because I can guarantee you with some of the temperatures we're going to be getting shortly, it is going to be well over 77 degrees. I know a lot of people carry it in their purses, which is great. You don't want it to freeze. So in the wintertime, you don't want it out there because if it freezes, you can't dispense it. I know law enforcement, they have their own job bags that they carry it in. So it's, it's with them and then it's in the car when they're in the car. But other than that, that doesn't have a problem. The protect from light, they kept that in, and I don't know why, because it used to be really important when there was vials or it was clear glass. These are plastic, so I don't think that's as much a problem. However, thing to be cognizant of is Narcan does have an expiration date, so make sure you keep aware of it and check it frequently. Now, like most medications, if it expired on May 31st, you can still use it in June, but work on getting a new one. Okay, because the longer you wait, the more ineffective the medication becomes. Next, please. Now, you have to take care of yourself too. There's a few slides here that tells you what you got to do. That little tiny glob of white is enough fentanyl to kill you. Now, a kilogram of fentanyl is more powerful. It is actually, let's see, I wrote it down so I wouldn't forget the dosage. It is 50 times more potent than heroin, and a lot of people mix the fentanyl with heroin because it's cost effective. It's significantly cheaper than heroin. So that works. And now they also mix carfentanil with things, which by the way, is 100 times more potent than fentanyl. Those are the true, hey, that would be a definite needle in the arm death, because as soon as they use it, they would die. It's just way too powerful to even try using. There's no medical reason for it. Next, please. Now, if you are ever in a situation where you're around someplace where there could be aerosolized fentanyl, make sure you have a dust mask on. I'm not talking just a blue mask. You want something that actually is good for dust. Sterile do not need to be used for the single-use exam gloves. It protects your skin and transdermal transmission. If it's around, your eyes are also a mucosal membrane. So you want to wear some glasses that's going to keep anything out of your eyes. Immediately wash your hands or any exposed area with soap and water. Do not use hand sanitizer or anything alcohol-based, because if it is on your skin, it will definitely increase the amount of absorption that occurs. I always tell people, if you've been in a situation like this, take your uniform off when you get home. Change, get out of your clothes as quick as possible. This is a what if type, and I don't know if it's ever happened, but this could happen. You get it on your uniform, you go home, your little one comes up to you and says, pick me up, and you love on them a little bit. It's bedtime, they're getting ready to go to bed. You love on them a little bit, and there's a little bit of fentanyl or whatever on your skin or your clothes, and they cuddle in and they get it and lay them down for sleep, and they don't wake up. So that's why I'm saying, get rid of the clothes, toss them in a wash machine, wash them right away, anytime you're in any kind of environment like this. Next, please. Now, NCAP. It's a NCAP program is where you can use your own insurance to buy Narcan. It'll cover up to $40 of your copay. You can go to the pharmacies and see if they're still taking it. I believe that they are, but check with your pharmacy if you plan on using it. The other thing is you can buy this over the counter. You can buy it from Amazon. It's anywhere from $25 to $35 a dose, or a 2-pack. Is it a 2-pack? Yeah, it's a 2-pack. So it's much more readily available if you don't want to use your insurance, because if insurance starts questioning this, you can buy it over the counter. Next, please. So this is my contact information. If anybody has questions or needs clarification and doesn't want to ask here, feel free to email me. Just put down Narcan question or something like that in the subject line. If you live locally, I'm more than glad to replace your Narcan if you need it. But that's about all I have for you guys, other than the fact that I wanted to let you know that Narcan administration by EMS providers in 22, between the ages of 25 and 64, there was that's about 80% of the people that received Narcan, that age group, and the 65 plus was 12.5%. Now this is for New York State, which is huge. And from New York State, their data for males versus females, it's almost a 3-to-1. Like I told you, some areas are 3-to-1, some are 2-to-1, but this statewide, it's a 3-to-1. Good resource for looking up any of this data if you want to delve even deeper is go to your site. And I see the question, can Narcan be refrigerated? No, it's not gonna work. You can't do that because it'd be below 55. So anyways, go to your state, if you're from another state, and look up whatever state it is, opioid data, and you will find more information than you'll know what to do with. It's amazing. It's wonderful. In New York State's posted their 2023, but they only have the old data from up to, like, some of it's 2020, 21, some of it's 22, but it doesn't have 23's data in there. So that's really, I hate that. I wish it was more current, but that's all I could get from them. So if there's questions, I cannot see. Let me see if I can bring up the chat screen. Oh, there we are. So if people have questions.
Thank you so much, Charlotte. I love when you present every year.
No, thank you.
I learned so much and so many reminders. I don't know. Can you talk a little bit more about carfentanil?
I don't know a lot about it. I just know it's really potent, and I know it's been out in some places.
Mm-hmm.
I know it was around for a while, and it was immediate deaths for people. It was not good. Fentanyl itself is nasty. Carfentanil, like I said, is 100 times more potent than fentanyl. And they're all synthetic. The other thing that they're putting in some things, oh, sugar, I didn't write it down. It's an animal tranquilizer. Xylylin or something like, I'm going to pronounce it wrong because I didn't write it down because that was really dingy. I wanted to make sure you guys knew that, but it's not. I didn't write it down because that was dumb. But anyways, it's an animal tranquilizer and people are mixing that too. Now, it is not an opioid, but it does cause respiratory depression in larger amounts. And some people are mixing the two of those together as well, can just potentiate the overall problem with respirations.
Mhm.
Anything else?
Any other questions?
Charlotte, I'm sorry if you covered this. Is there a minimum age that you can become trained?
No, I'm going to be honest. I totally meant to tell you guys that. I will train anybody on how to use Narcan. I have trained them younger than 12 years old if they have a family situation where it's vital to have in the household. I don't like to do it without parental consent, but if I have some family member telling me it's okay, I will do it. I've had parents bring their children to my classes so they learn how to do it, which I have no problem with whatsoever. Like I said, the youngest one I trained for in-home use was 12, and that was with not immediate parents' permission. It was a grandparent's permission because her son and daughter-in-law were both opioid users. And she
And
was
along
worried.
those same lines, is there a minimum age you can give of the recipient of Narcan?
Not to my knowledge.
Okay. And then what was the amount of fentanyl in the slide with the picture of the penny?
The actual amount I can't tell you as far as measurement goes, because I borrowed that slide and it didn't give me the information. Just that amount could kill you if you were to take it. That's what it said. Sorry.
Mm-hmm.
Anything else, guys?
I don't see any other questions. So I'm going to thank everyone for joining us today and give you back a few minutes of your day. I will email you after this session with an evaluation link and the information on how to collect your continuing education credits. But remember, give us at least a week to get those ready for you. And we truly appreciate you all coming and joining us for the 2024 Opioid Webinar Series. This is our last one for this year. And we hope to see you next year. And Charlotte, thank you for being 5 years in a row. If for Saturday Night Live, we'd give you a green jacket for being here 5 times. But we truly appreciate you and your expertise.
Thank you very much.
You're welcome.
You guys
And
all have a great day. Thank you.
Thank
you
you.
too. Everybody have a wonderful summer and we'll see you soon. Bye.
Bye.